I don't have any problem with people using herbal medication for, particular treatment or for particular disease, but there is some reason why most clients don't have courage or they don't believe this herbal preparation. Okay, I work with a lot of herbalists. They are good, and they even treat certain diseases that I've referred to them before. But just that, we Africans sometimes, if you ask somebody to go for herbal medication, they may not even give you any symptoms that they're experiencing, but they will just go for it and can cause other underlying health conditions. So I'm here to give you some reasons why the public do not believe too much in herbal medication. You see, before someone go for herbal medication, or let's say before you call yourself a herbalist, you should know something about the herb that you are using, especially the active ingredients that are found in those particular herbs. If it's neem tree, or maybe mango tree, or pawpaw tree, you have to get a medical knowledge about that. Most herbalists, they don't have any medical background. Most of them, they will just sleep when they see something like dream. Oh, they use this to cure this, no, then they will come out and say, okay, you can use this and cure this. They don't explain a lot of things about it. And also, some people add other pharmaceutical drugs to the herb that they are preparing. They can even add a malaria medication to it. They can even add paracetamol to the same preparation. And imagine you taking such herbal medication. If you are not careful, you can activate another underlying health condition. And also, the herbalists, they don't even have much time to give you the side effects that come with the medication. See, every medication on this planet have side effects. Okay, the fact that you do not experience the side effect doesn't mean it doesn't exist. There is. But for them, they just want their money. They will just tell you that, okay, this medication can cure like 4 diseases at the same time. They will not even tell you even the exact dose. If you're asking someone to just go and take cup, or let's say teacup, like it one in the morning and one in the evening, do you know people take up? Someone take up can look like kettle or can look like they don't explain it well and they don't demonstrate it well for the patient to say, okay, this is the particular teacup that I have to use. Even if you talk about tablespoon, do you know people tablespoon? It's a normal tablespoon that is the big one, but we have different type of tablespoons. So you explain it well. But these herbalists, most of them, they don't do that. So now let's come back to the active ingredients that are found in those herbal medications. Okay, some people can be allergic to those ingredients. I don't have any problem, but try your possible best as a herbalist to explain to them that, okay, this herbal medication, we've added a little fruit to it. Let's say mango, or let's say pineapple. You know, most people are allergic to pineapple, and allergic reaction, it is normal. Okay, you just have to know what you're allergic to. So if I know that I'm allergic to pineapple, and you've added pineapple to this particular herbal medication, okay, if I'm going for it, I'll tell you that, okay, doc, please, I'm allergic to pineapple, so how will I go about it? Then you say, okay, do this and do that. But all they do is, most of them there's no indication, there is no sticker on the herbal medication for you to read. Even when they have one, they will not list all the ingredients that they use to prepare that particular herbal medication because they thought somebody may steal the idea. But for me, I didn't see it that way. They have to make sure they list every ingredient that they use to prepare that particular herbal medication so that the one going for it will read and know if he or she is allergic to any that is written on that particular herbal preparation. So as I said, I don't have any grudge against the herbalists or those who go for or those who prepare herbal medication. Okay, but what I'm saying is they have to do their possible best to either have a basic medical knowledge about the ingredient that they're using to prepare the herbal medication, or they have to explain everything, especially the dosage to the client. And other one is they have to let the client do certain tests. Okay, they have to let them do certain tests. Someone is having high blood pressure, maybe that herbal medication, it is not good for those who are having high blood pressure. So that is why I'm saying there is a particular reason why most people do not believe in herbal medication. But the most important one that I'm touching on is, please, those of you have been adding paracetamol, codeine, and other things to the herbal medication, please, why should you even do that? If your medication is correct, why do you even need pharmaceutical medication? Or why do you have to add pharmaceutical drugs to that herbal medication? Please, I think we need to be careful, especially those who going for herbal medication. That is why I can't just stand up and ask you that, oh, please go and get this herbal medication. I hardly do that unless I know the herbalist one on one, or I've worked with the person before. Then there will be a trust there. But if I'm just maybe you met me online and you're asking me to recommend a herbal medication for you, I hardly do that unless I know the herbalist that is behind that particular herbal medication. Please, our health is very important, so you should kindly take note. Don't just stand up and go for any herbal medication that is out there, especially those who are online. Someone is selling a herbal medication that can make your basilica strong. The person don't have any medical knowledge about that particular medication that they are selling. A lot of them are online there. Testimony are there, but do not follow testimony and go and get the wrong medication.